Many painful teeth do not need a root canal. First, I examine your tooth carefully with simple tests and an X-ray before deciding on the best treatment. A root canal is needed when the nerve becomes infected. Deep decay, cracks, or injury are the most common causes. I remove the infected tissue, clean every canal, disinfect them thoroughly, and seal the tooth to stop bacteria returning. A rubber dam keeps the tooth clean and dry. It improves safety and helps me perform treatment more accurately. After treatment, a proper filling or crown protects the tooth. With good care, it can last for many years. A root canal saves your natural tooth. Early treatment prevents bigger problems and helps keep your smile healthy.